Mrs. S is a 28-year-old African-American female. She was admitted to our floor in the ER with a complaint of right upper quadrant abdominal pain, fever, and right shoulder pain. She rates the pain 9 out of 10 and describes it as an aching pain that is constant. She tried taking ibuprofen every 4 hours for the pain with slight relief. Her past medical history includes hypertension. Her current medications include Norvasc 5 milligrams every day and Litensin 20 milligrams every day. Her last menstrual period was last week, May 19, 2014. Her husband is away in Iraq and she has not been sexually active for 4 months since he was last home. Mrs. S denies smoking cigarettes or using drugs. She admits to an occasional glass of wine. She was given Demerol 75 milligrams and Phenergan 25 milligrams intramuscular in the ER about 2 hours ago. Her pain has decreased to 6 out of 10. The ER physician has her scheduled for an ultrasound of the abdomen. Her recent blood work in the ER showed to be normal except for the elevation of white blood cells of 15. Her vital signs are 100.1. Her heart rate is 85. Respiratory is 12 and her blood pressure is 140/70. She's 205 pounds and 5 foot 5 inches. Lungs are clear to auscultation and percussion. Heart is regular rate with normal S1 and S2. Abdomen is tender over the right upper quadrant with guarding. Vowel sounds are present times 4 quadrants.
Okay, thank you. I'll take over from now.
Thank you.
Hello. Hi, good afternoon, Miss S. I'll be your nurse for tonight. How are you feeling?
Oh, not too good. My stomach and shoulder really hurt.
Oh, when did your stomach and shoulder start hurting?
2 days ago, but it got worse last night.
Okay, and can you point to the area where it hurts? Okay, and the area of where your shoulder hurts as well? Alright. And how long does this pain last?
It's a constant achy pain.
Okay, from a 0 to 10, what would you rate this pain?
It's a 9.
It's a 9? Alright. And what makes this pain worse?
I notice when I go over bumps when I'm driving, it gets aggravated.
Okay, and what relieves the pain?
I've taken ibuprofen, and that helps a little.
Okay, well I'm going to do a quick assessment on your abdominal area and see what's going on.
Ouch!
Oh, does it hurt there?
Yes.
Okay. Does it hurt here? No. What about here?
Not so much.
Okay. Alright, so we're all done right now. I'm going to go to the doctor, give this information to him, and I'll be back with you shortly.
Thanks.
Our nursing diagnosis is alteration in comfort related to possible infection as evidenced by patient's fever, elevated white blood cell count, and verbalization of pain 9 out of 10 on a scale of 0 to 10. Our short-term goal is that patient will report pain level of 4 out of 10 on a scale of 0 to 10.
Our long-term goal is that our patient will report no pain by discharge.
Our short-term interventions are that the patient must be able to respond immediately to complaint of pain, give analgesics as ordered, evaluating effectiveness, and observing for any signs and symptoms of untoward effects. Eliminate additional stressors or sources of discomfort whenever possible.
For our intervention, our long-term goals are to provide anticipatory instruction on pain causes, appropriate prevention, and relief measures. Notify physician if interventions are unsuccessful or if current complaint is a significant change from patient's past experience of pain. And provide rest periods to facilitate comfort, sleep, and relaxation.
Hello again, Miss S. How are you feeling today?
Feeling good.
I'm glad to hear that.
This is my mom. She came to pick
Oh,
me up.
nice to meet you. Okay, so before you leave today, I just wanted to give you some information on how to manage your pain and discomfort once you're at home. Alright, I'm really glad that your mom is here because it is really important to have family involvement. It helps the patient recover more quickly. Okay, so will you be the main person
Yes.
at home?
I'll be home most of the time.
Okay, that's good. So these next few days, you will not be able to pick up any heavy objects. You will need to be in a calm, quiet environment just to prevent any stimulation of the pain again, okay? Alright, some activities that you can do to promote relaxation will be like massage therapies or breathing exercises. Do you know how to give massages?
Yes, I'm pretty good.
Okay, that's good. That would be really good for her to relieve the pain. Okay, Miss S, if you do experience any pain at home, you can take the prescribed medication that we gave you. And if the medication is not working properly, you can contact your primary physician. Okay, will you be cooking?
Yes, I'm the one who prepares most of the
Alright,
meals.
that's good. You know, she does need to consume plenty of water and healthy food, so it needs to be balanced, and that'll help her recover and sustain her energy to recover, okay? Alright, and lastly, we will have to do a follow-up appointment, probably for next week, just to see how you're doing, okay?
Okay.
Alright, do you have any questions?
No.
Do you understand everything that I told you?
Yep. Get plenty of rest. Eat healthy. And take my medication.
Okay, perfect, that's it. And I'll see you next week. Please call if you have any questions.
Okay, I will.
For our evaluations, our short-term goal was met as evidenced by patient stating her pain of 4 out of 10 at the end of the shift.
Our long-term goal is met as evidenced by patients stating no discomfort and pain is at 0 out of 10 at discharge.